Why does a vial of insulin, which costs between $5 to $10 to make, retail for $300 to $400 in the United States? An intriguing question that shines a spotlight on the current state of prescription prices in the U.S. Welcome to the world of the American pharmaceutical industry, a realm where innovation and invention often come at a steep price, a cost that seems to be borne disproportionately by the American public. Consider this. Americans pay 4 times more for their medications than any other country in the world. Is it because the drugs are 4 times better? Not quite. The culprit behind these astronomical prices is the lack of regulation on what pharmaceutical companies can charge. When a new effective drug is developed and approved by the FDA, there are no limits to what the manufacturer can ask for it. No regulation, no competition, just a free rein on pricing. But it doesn't have to be this way. In Japan, for instance, government officials meet with pharmaceutical companies to negotiate prices of medications before they are allowed into their country. This proactive approach ensures that the cost of these life-saving drugs remains within reach for their citizens. Furthermore, other countries use a median pricing system where they pay an average price for each drug based on what other nations are paying. This approach brings a level of fairness and transparency to a market that can otherwise seem like a free-for-all. In the United States, however, the pharmaceutical industry enjoys a level of influence that can often sway political decisions. Large campaign contributions and lobbying efforts can persuade politicians to vote against any type of regulation, perpetuating this cycle of high drug prices. But this isn't just about dollars and cents. This is about the quality of life, about access to necessary medications, about the health and well-being of the American people. Senator Bernie Sanders, appointed by President Biden, is currently investigating pharmaceutical price gouging and the monopolization of the medication industry. This is a step in the right direction, but it's just the beginning, so what can you do? It's quite simple, really. Support measures to regulate drug prices. Advocate for fair and reasonable pricing. Stand up for your right to affordable health care. After all, isn't that what the American people deserve? A chance to live healthier, longer lives without being burdened by the cost of their medication. It's time to take action. It's time to ensure that the American pharmaceutical industry works for the people, not against them. It's time to make a change. And that change starts with you.